Have you recently been referred to a doctor who you have no idea what they specialize in? The anesthesiologist wants to see you, sir. Are you a medical student soon going to complete your medical degree and are overwhelmed by the number of specialties that exist in the medical field? Well, in both situations, don't worry. Welcome to Demystifying Medical Specialties, where we have done all the research for you so you don't have to. If you watch until the end, you'll even get to see some bonus tips for how to apply to a Canadian residency program. Now, please note this information applies to Canadian residency programs only. Job descriptions and salaries are also Canadian, meaning it may or may not reflect that of countries outside of Canada. Before we start, if you haven't yet already, hit that subscribe button, press that notification bell, and share this video with as many people as you can so that everyone can benefit. So, let's start off with internal medicine. Internal medicine is a specialty in which physicians have the training and education of all the organ systems in the body, and so they can diagnose and treat really any disease. The patients they often work with are critically ill. This field involves you to be on call working with emergency room physicians. The primary practice places are academic health sciences centers and community hospitals. The residency program is 3 years, after which residents can choose to subspecialize in another specialty, such as respirology or geriatrics. The average base salary stands at approximately $140,000. Now, are you thinking about what your family doctor specializes in? Or as a medical student, are you thinking of a specialty where you can open your own practice and treat families in your community, for example? Well, this specialty is called family medicine. Family medicine comprises doctors who have the knowledge of treating any kind of disease, provide good health and wellness tips, conduct health screenings, and do physical examinations. The patients family doctors often work with are not critically ill. They run their own private practices, although they can get hospital privileges or work in community clinics. Family physicians have to spend some of the fewest years in residency, which is 2 years. An average base salary that can be expected is $154,729. Now, what if you wondered whether there's a doctor specializing in the care of younger ones, or as a medical student, a specialty that allowed you to focus your career on children? Well, stop wondering and start listening. There's a specialty called pediatrics, where at the center of it is children. Physicians trained in this specialty treat illnesses specific to children, and the severity of the disease does not matter. These physicians work out of their own clinics at academic health sciences centers and community hospitals. The residency program for this specialty is a little bit longer than internal and family medicine, as it is 4 years. The average base salary that can be expected is $128,500. Now, are you wondering what the specialty of a doctor who focuses on mental health is? Or are you a medical student who wants to contribute to helping people with their mental health challenges and help end this mental health stigma? Well, this specialty is called psychiatry. Physicians practicing psychiatry gain training in diagnosing and treating mental health disorders and promoting better mental health. These physicians work out of their own clinics at academic health sciences centers, community clinics, and hospitals. The residency program is the longest of all the specialties we have discussed so far at 5 years. The average base salary that can be expected is $171,054.
Being a surgical resident means that you would learn about a multitude of instrumental techniques to treat an injury or disease, directly dealing with the organ or tissue manually. Of course, surgical operations occur in an operating room, or an OR for short. Additionally, surgeons spend their days in the ICU, the ER, and consulting patients and discussing their operation in offices. The latter is the case most of the time when surgeons aren't operating. In Ontario, the length of the general surgical residency program is 5 years, with an average annual salary of around $194,000, which can go up to $300,000. If performing many surgeries isn't for you, but you are interested in helping women maintain a healthy pregnancy and want to be in charge of delivering babies and maintaining women's health, then becoming an obstetrician gynecologist can be a great option for you. OBGYNs are responsible for overlooking and taking care of pregnant women before, during, and after childbirth. The reproductive system of women also faces many issues, and being a gynecologist would entail taking care of these issues apart from pregnancy. They work in hospitals, clinics, or academic health centers, which are especially popular for birth control counseling. The residency program is 5 years with a salary of $198,000. Do you still want to be in an operating room but not a lead surgeon? Anesthesiologists have a huge role in the OR and they don't even touch the patient during surgery. These are specialists responsible for controlling and maintaining a patient's vital signs during surgery, such as heart rate, blood pressure, body temperature, fluid intake, and balance. They're responsible for compiling a history of the patient and understand which anesthetics work for them the best to avoid allergic reactions, for example. And if working with patients all day simply isn't the right fit for you, but you still love science and healthcare, consider pathology. This is a specialty that doesn't deal with the traditional doctor patient role, but rather someone who examines body tissues and samples to detect any disease or abnormalities. This means working in a lab, running a series of tests, and examining cultures and specimens underneath a microscope.
Do you want to work in an environment that is diverse and interactive? Perhaps emergency med is right for you. There's always something new. ER doctors assess and treat patients in the emergency department. Regardless of the illness or injury type, emergency medicine physicians are the first in line of treatment in the case of acute illness or injury. You must complete a 5-year residency program if you wish to pursue a career in emergency med. The average annual pay for an emergency med physician in Ontario is around $317,000 a year. Perhaps you're looking to specialize in something more specific, like the cardiovascular system. That's the job of the cardiologist. Cardiologists specialize in the treatment and diagnosis of heart health and conditions such as heart attacks, heart failure, arrhythmia, high or low blood pressure, and lots more. After completing med school, cardiologists spend 3 years learning general internal medicine as a resident, plus at least 3 more years of specialized training after that. The average cardiologist salary in Canada is around $325,000. Maybe the cardiovascular system doesn't interest you, but how about the nervous system? Neurology may be best for you. Neurologists diagnose and treat nervous system disorders and conditions, such as stroke, seizures, Parkinson's, multiple sclerosis, and many more. After completing med school, residency training in neurology takes about 5 years. The average neurologist salary in Canada is around $300,000 a year. Lastly, we have diagnostic radiology. These doctors specialize in detecting and diagnosing disease and injury by using medical imaging equipment, such as X-rays, computed tomography, magnetic resonance imaging, positron emission tomography, fusion imaging, and ultrasounds. Upon completion of medical school, it takes an additional 5 years of residency training to become certified in diagnostic radiology. The average radiologist salary in Canada is around $325,000 a year.
Thank you so much for watching to this part of the video, and now we'll be showing you that bonus tip on how to apply to a Canadian residency program. In Canada, we use something called the Canadian Resident Matching Service, also known as CARMS. If you're in your final year of a Canadian medical program, your medical school has already provided your name to this organization, and this organization called CARMS will send you an email with all of the information on how to log in into the CARMS account and apply for a residency program. So once you log in into your CARMS account, you will see 4 boxes. R1 is the box you click when applying right out of medical school. MSM is the box you click if you're currently an internal medicine resident, for example, who wishes to subspecialize into respirology, for example. FM or ES is the box you click if you have completed training in family medicine already and wish to learn more enhanced skills. PSM is the box you click if you completed pediatric training already and wish to subspecialize in pediatrics, such as pediatric surgery. Then, you basically create an application for the specific program you're interested in at a specific school, rank your choices, attend interviews, and wait for matching day. Now, what if you're an international medical graduate? That is, you have not obtained your medical degree in Canada but elsewhere in another foreign country. Well, first of all, your medical school must be on the World Directory of Medical Schools website. Second of all, you have to complete and pass the National Assessment Collaboration Exam. Third of all, complete and pass the Medical Council of Canada MCC qualifying exam, after which you can apply to a residency program in Canada. So, we hope you guys learned a lot about the different specialties in medicine. We also hope this relieves some stress for medical students about residency programs, as these are what you'll be practicing for the rest of your life. Thank you so much for watching.